So I've taken a look at the law survey for 2019, and overall from it you find a lot of different things that are state specific for you. So it's very long. I think it was like 120 pages, but you're only really going to be looking at less than 20 of those pages. So you can go through that thing in about 15 to 20 minutes. And for this video, I'm going to go over what I learned from that survey regarding Alabama. So it might be different in your state, could be the same. Definitely go through it and compare. So to start, we have Alabama. There are 1,500 hours of internship may be obtained through a college structured and non-structured program, all under the supervision of a registered preceptor. That's 400 hours of the minimum total requirement must be obtained after completing the requirements of the second professional year, so your P2 year. The 400 hours must be completed in a traditional setting. This emphasizes on distribution of medicines, prescriptions, and medical supplies. Also learned some things about your foreign pharmacist licensure program. So the NABP provides a Foreign Pharmacy Graduate Examination Committee, FPGEC, certification program as the primary means of assisting boards of pharmacy in accessing the educational equivalencies of foreign pharmacy graduate educations, as well as their licensure and our registration to practice pharmacy. That was directly from there. It's a 3-part process of certification. They must document their educational backgrounds. The evaluation of the academic program is performed. They do have to take the examination, FPGEE, as well as demonstrate English language proficiency by obtaining the minimum acceptable scores on the test of English as a foreign language internet-based test, TOEFL IBT. Candidates must also attain passing scores in each of the 4 sections of that as published in the application bulletin. So there's your own bulletin for foreign. But for Alabama, something noteworthy of the foreign pharmacy licensure is that, well, pretty much everything I said. They have to have 1,500 hours of practical experience. Appearance before the board is necessary. So there's not a lot, and I don't see getting a lot of questions on that on the exam. I've never heard of such questions. So, but in Alabama, in this area of law, we also find that a pharmacist must complete 15 hours of continuing education previously approved by the board. However, this requirement shall not apply to the ACPE approved continuing education courses for which a program number is available. That's how Alabama works. So 15 hours of CE a year, that's 30 every 2 years because your license is renewed every 2 years. In Alabama, something in the law mentions that hospital and community technicians do not check the work of other technicians. So there's no check tech program for Alabama. So let's see some of the requirements. In Alabama, your non-resident pharmacist must be licensed, of course. The state does not have a separate license category for specialty pharmacies. They do have a special license that are for being registered as with the FDA as outsourcing facilities. And our state does issue license for sterile compounding pharmacies. Let's see. There are fees. I don't think fees are part of the exam. I'm really not sure, but they're everywhere, so it might be important to know. For in Alabama, your initial licensure registration fee is $500, renewal fee is $400, renewal schedule is every 2 years, and your initial controlled substance fee is $300. Also in Alabama, we have your controlled substance renewal fee, $300, controlled substance renewal schedule, also 2 years. Alabama does not recognize VIPPS accreditation. Not entirely sure what that is. We do recognize the VPP, and we do not require the VPP. So prescription orders with Alabama for non-controlled substance or legend drugs from out-of-state prescriber, that yes, is still valid. For controlled substance from out-of-state provider, also still valid. controlled substance based on an online questionnaire is not valid in Alabama. And a prescription order is not needed to buy syringes or needles in Alabama. So are syringes and needles restricted to sale only in pharmacies? No, not in Alabama. The time limit on prescription refills, there isn't any, except the 6-month limit on prescriptions and controlled substance schedules, of course, your 3 to 4 and 5. Well, your 3 and 4 have a 6-month limit. Allow sale of Schedule 5 preparations over the counter? We do not in Alabama. Or have mandatory PMP reviewing requirements? No, not in Alabama. So our state, do we require identification for Schedule 2 controlled substances prescriptions? Yes. For patients owned onto the pharmacy staff, we require identification for Schedule 2 controlled substances. Do we require identification for controlled substance prescriptions other than Schedule 2? No. Do we allow the use of pre-printed prescription forms for non-controlled prescriptions? Yes. And no prescription blank shall bear the imprint of the name or address of any pharmacy or pharmacist, though. Do we require expiration or beyond use date on prescription vial labels in community practice? Yes. Must be on compounded drugs for prescriber's office use as well. So of note, prescription pads must have 2 lines in Alabama. Is prescription transfer from out-of-state pharmacy computer to in-state pharmacy computer allowed? Yes, if they share the same system. So some patient counseling requirements. For Alabama, Medicaid patients, yes, they are required. The offer to counsel is mandatory. The offer must be face-to-face unless in the professional judgment of the pharmacist face-to-face counseling is inappropriate or unnecessary. And in that situation, the offer to counsel may be in writing, by telephone, or by any other manner deemed appropriate by the pharmacist. All other patients, yes, and the same thing. New prescriptions, yes, we counsel. The offer to counsel is mandatory. For prescription refills, it's when applicable appropriate. So in Alabama, only when appropriate in judgment of a registered pharmacist. So must patient counseling be performed personally, face-to-face, by the pharmacist? Yes. Are the patient profiles mandated? Yes. So who can prescribe in Alabama? So let's see. So people who can pretty much survive any drug, it's going to be physicians, your MDs, doctor of osteopathy, your DO, your dentist, DDS, DMS, of course not C1s when I say any drug. This is C2s, C3 to 5s, and your legend drugs. So a dentist, the legend is within scope, of course. And your podiatrist, your PDM, that's C2s, C3 to 5s, and legend within scope. Your veterinarians as well. So those are all the same. Veterinarians also are DVM, so they have their name, comma, and then their MD, DO, DDS, DMS, PDM, or DVM. They can pretty much get any drug that's within their scope of practice. You have your optometrist, your ODs. These can prescribe C3s to 5s and legend drugs within scope, but they cannot prescribe C2s in Alabama. Your physician assistants, your CNMs, your CRNPs, they can prescribe legends within the QACSC and your controlled 3 to 5 drugs. And they can also do C2s with the LPSPs, the permit. So just to clarify some of that, for our prescription expirations in Alabama, there's no expiration for your legends, your C2s, or your C5s. There's a 6 months after written or 5 refills, whichever is earlier, for C3s and C4s, and stock expiration or 1 year from the day for your return to stocks. So prescriptions, just the C3s and your C4s. Something else I want to clarify are some of those acronyms. So I said CNM, that is your certified nurse midwife. So a midwife, a nurse practitioner, and a physician assistant all have that mid-level prescribing authority in Alabama, so they can prescribe within their scope with a Certified Alabama Controlled Substance Certificate, the QACSC, and they can prescribe C2s as long as they have the Limited Purpose Schedule II Permit, LPSP. Alright, thank you. Good luck on your exam.